With that, before we get started, I'd like to let you guys know about our speaker today. Since October 2018, Chris Grimes has held the position of Emergency Management Director for Forsyth County. In this role, Chris oversees all emergency management activities, including planning for large-scale emergencies and disasters, as well as overseeing the Emergency Operations Center and some homeland security issues for Forsyth County and the city of Cumming. Prior to his role as director, Chris served as deputy director of the Forsyth County Emergency Management Agency from September 2013 to his appointment as director. In July 2019, the operations and administration of the Forsyth County 911 Center were realigned to be a part of the Emergency Management Agency, where Chris now serves as the 911 director in the role of Emergency Management Director. During Chris's time with Forsyth County, he has overseen the recovery from 2 presidential disaster declarations, bringing over $500,000 back to Forsyth County as reimbursement for local money spent on the ice storm in January of 2015 and Hurricane Irma in 2017. Chris not only is involved in emergencies in Forsyth County, but has been deployed to other areas during disasters such as the 2011 tornadoes in Ringgold, Georgia, the Georgia coast during Hurricane Matthew, and the State Operations Center during Hurricane Michael. During Super Bowl 53, and this is really neat, Chris oversaw all communications for the All-Hazard Command Unit, which consisted of federal, state, and local bomb disposal, K-9 tactical weapons of mass destruction, and counter sniper teams. Chris holds a master's degree, a bachelor's degree, and is a graduate of South Forsyth High School. Chris and his wife Leslie are also small business owners in Forsyth County and just really awesome people. I am really excited to have Chris on today and to talk about this incredible topic. And Chris, with that, I will turn it over to you, and you take us away.
All righty. Thank you. Good morning, everybody. Hope you're doing well. Let me get the screen share going here 1 second, if you'll bear with me. All right, perfect. All right, well, thank you, everybody. I'm going to try to get through this this morning. I know there is a lot of information out. And so what we want to do is lay out some best practices, some things to think about as you begin to reopen your business so that you do it in a safe way, but also take into account a lot of the factors that are around us now. What I want to do is let you know that this is not tailored to any one specific industry. I know there's a lot of industries that are represented here. We're going to try to give you some basics and some best practices, but not really get into industry-specific recommendations. We're going to show you where some of those things are and where to find those so that you are prepared for your industry whenever you do reopen. So we want to let you know that. Also, we will try to get to your questions. If we go long and we do not have a chance to answer all the questions that are presented, I've told Jimmy and Jesse that we will get those. They'll email them to me. We will get them the answers back to you just as soon as. But before I get started, I want to say a thank you. I want to say thank you for everybody in the community for your support of Forsyth County, supporting each other and supporting our community. And as we've said a lot of times, we stay Forsyth County strong, and we want to thank you for that and for your dedication to ensuring we have a safe county, we have a healthy county, and that we are going to set the example, be the role model for surrounding counties. And as we look to your peers and other places, we hope that they look to you as an example and role model for how to begin to reopen business. We know that the last few weeks has been hard. Trust me, I know that. It has been hard on everybody. But we do want to, you to, as you begin to reopen, we want you to do it in a safe manner as possible. Those are some of the things we're going to talk about today. With that, we'll get started. So before we get started, there's a couple things that I want to address that a lot of what we will discuss is based on some of the information in the executive orders issued by Governor Kemp. Those executive orders, there have been 3 that relate to reopening of businesses and reopening of the state. And so those executive orders you'll see at the bottom of the slide those can be found on in the chat feature. Everybody should have some links that we put in there, and you'll see those executive order, a link to all of Governor Kemp's executive orders. But those three specifically relate to the reopening of businesses. So we want you to make sure that you have had a chance to review those executive orders. We want you to make sure you're reviewing any guidance issued by your professional organizations or governing bodies. For instance, we know that the Georgia Board of Cosmetology and Barbers issued some guidance, and so we want to make sure that you know where to find that information. If you don't know where to find that information, we're going to have some resources for you as well, and we'll go over that towards the end. But make sure you're paying attention to your governing body, your regulation. If you are regulated by, for instance, Georgia Department of Public Health or Environmental Health, if you're a restaurant, make sure you're receiving information from them to ensure that you stay in compliance. Also, know where to find official information. I say that there's a lot of information floating around on the internet. Know where to find official information. You can find that from the state. You can find that from the county. Forsyth County has a COVID-19 page where we're posting all official information. So know where to find official information, not just things you read online. So before we get started, we want you to know that we are going to reference the executive orders, but we are going to, like I said, we're going to talk about a few things just at a high level as well. Okay? So, know a few things. The shelter in order place remains in effect through April 30th. So for groups, at-risk groups, that shelter in place order does remain in effect through April 30th. What the reopening and some things have done is allow businesses to begin minimum basic operations. That is defined in the executive order of what that means. However, at-risk groups, and there is several of them, are encouraged to continue to shelter in place through May 13th. So that may apply to you. You may have employees who fall into one of those groups. They may be one that they may have chronic lung underlying health conditions. That's one of the groups. So there are several groups that applies to, and we can look at that in the executive order at the end. But we want you to know that may apply to you. You may have employees that fall into those at-risk groups, and those are recommended they continue to shelter in place through May 13th. Executive order also encourages all businesses to continue to implement teleworking for all possible employees. Okay, so if you can continue to telework, you can continue to do things remotely. That is encouraged. You continue to do that for as long as you can. We understand that probably a lot of people are anxious to get back and to reopen your business, but we want you to know that we encourage, and we want you to, and Governor Kemp encourages you to continue to telework for all possible employees. That also includes holding all meetings and conferences virtually whenever possible. I know here at the county, we have a staff meeting. We have been holding that virtually now for a while, so that we are all not in the same place. And that way it also takes and helps that if one of us, unfortunately, if one of us were to get sick, maybe we all don't get sick. So we want to make sure we are spreading people out. We are social distancing. Sometimes we don't think about it and we let our guard down around people that we know and around people that we're around a lot. But we have seen across the state people that can spread the virus and not even be showing symptoms. So we do want you to know that we encourage you to continue to hold all meetings and conferences virtually as your technology allows you to do that. So some considerations to reopen. We're going to talk about these a little bit more in depth, but we want to definitely address, these are some of the things we're going to address today. We want you to begin, if you've not, I'm sure all of you have begun to think about, okay, what do I have to do to reopen? What do I have to do to get back in business? What do I have to do to ramp back up my operations? By production, if you're a manufacturing facility. So determine steps to reopen your business. So these are some of the things we're going to talk about. We need to check on employees. You may have critical suppliers that you need to ensure the status of them. Notify your vendors and support personnel that you're going to start opening back up. You may have people that work in your facility that may not be a direct employee, that they may be hired through a third party, or you may have a vendor on site that supports you. You may have an on-site health center. Those are things that we want you may need to be notifying them that you are going to be reopening. So you're going to want to inspect your facility. Ensure things. You may have been out of the facility or not had a lot of people in there for a couple weeks, so you need to inspect your facility, test your systems, and don't forget to update your website and social media when you begin to reopen and what that looks like. So we're going to go a little more in depth on these and talk about these, like I said, a little more. When we talk about employees, everybody knows employees are your most valuable asset. Okay, it doesn't matter what business you're in, employees are your most valuable asset. So some things that you want to consider is, what are the status of your employees? I'm sure many of you, if not all of you, have been checking on your employees if they've not been actively working for the last few weeks. But ensure you know the status of your employees. Are they available to come back to work whenever you're ready to open? Are they caring for anyone? You may have employees who have children at home. You're going to need to know that going into this, that you're going to have to be flexible with people. Are they caring for a senior where they need to protect themselves because they may be caring for somebody, a senior or somebody in one of those at-risk groups where they have got to be careful of being out and about and bringing something back to that person. So make sure you know what the status of your employees are. Have they contracted the virus? So those are some things that you're going to want to know before you bring everybody in. It's also a good idea to know on the employees, or if they're caring for anyone, to make sure you know that. So for the future, everybody may be fine at their home now or who they're caring for, but you're going to want to know who in the next few weeks. Unfortunately, this virus is not going away. So as you begin to plan your return to work, know that things still may come up. And so know who they may have to care for also in the future. Have you cross-trained employees? Like we talked about, this virus is not going away. So if an employee were to contract the virus, even once you do reopen, if they go out for 14 days or so, do you have somebody that can fill in their position once they are out? So those are the things that you're going to want to make sure that you answer as you open. What is your expectations of your employees when they return? Are you going to work a normal? Do you plan to go to a normal 8 to 5 and everybody be there? Are you going to begin to phase things in? Are you going to stagger shifts? I heard somebody everybody was chatting before we got started that people are going to begin to reopen their offices, but they're going to split shifts, split people. That's what we've done here in my department, where we're all not here at the same time, where some of us work certain days in the office and some of us work certain days remotely. So set those expectations now so that you know when you begin to address your employees how you're going to manage them coming to the office. Staggering shifts is a great idea. Not having everybody be there at one time, even if they are going to be in the office. Have everybody, arrive at different times, so there's not a large amount of people trying to get in at one time, so they can continue to social distance. One thing that is in the executive order is employees should not be congregating in the workplace. So make sure you have a plan on how to allow employees break time, whether they can eat meals and everything in offices, or you can separate employees. Make sure you are able to do that and that they don't congregate all together. Remember, we want to continue to social distance individuals going into even once they return to the workplace. So those are some things to think about with your employees. Suppliers, what are the status of your suppliers? We know a lot of businesses, not everybody is a manufacturer, and even if you are a manufacturer, you tend to get supplies from other people. So what is the status of your suppliers? You may be ready to open, but your supplier may not be ready to supply you. They may be experiencing supply chain issues. So make sure that you are working with your suppliers in advance before you begin to reopen to ensure you are ready. They are ready to support you. Have they changed their processes? We've seen a lot of businesses have changed their processes, whether it be how they deliver products, whether it be how they support other businesses. You need to make sure that you know if they have changed their processes going into when you begin to reopen, if you're supported by someone else. Do you need any new suppliers? So when we'll talk about this in a few minutes, but is with personal protective equipment, do you need to buy masks for employees? So do you need new suppliers? Make sure you have that, and you have suppliers for hand sanitizer, masks if you need them, all those kind of things before employees begin arriving, so that you know where to find them and you know if that supplier is going to be able to support you for the long term. It may be great that you have things to reopen for day one, but as you get into week 2 of being open, do you have the supplies you need to continue operations? If you do work with critical suppliers, have they or will they notify you if their status changes, if they begin to experience supply chain issues, or if they have an issue with their company? Do they have a way to notify you of those changes, of those issues that they may be having? If you have a critical supplier, those are things you're going to want to work out beforehand so that you are prepared if they have something that they have to adjust. You know what to do, and you know where to expect that information to come from. So we talk about facility. Some of you hopefully have been in your facility, but it may not have supported people for the long run over the last few weeks. Take time to inspect your facility. Make sure you've not had a water leak develop. Make sure everything is working the way that you expect and it worked before you left. So take time to really inspect your facility. Make sure things work. If you need to perform any kind of goes into testing systems, but if you need to perform any kind of preventative maintenance on equipment or on your facility, do that now. Take time to do that now so that it is ready when customers begin arriving. Make any changes before customers begin to arrive, such as if you're going to put up, we've seen a lot of businesses put up like plexiglass shields or put things on the floor to help people social distance. If you're going to do those things, make sure that you do that before employees begin arriving. You're going to put protective things in place. Do that after customers begin arriving, then you may potentially already expose your employees. So make sure you make any changes before your customers begin arriving. And ask yourself, in your facility, can employees effectively social distance? Are you able to keep people away from each other in offices, in those things? And can customers social distance? There is some limitations on customers waiting. For instance, if you run a restaurant, customers are not supposed to stand and gather as they wait on tables. So do you have a plan in place on how to allow customers to social distance in your facility? Test the systems that you use regularly in your facility. We want you to make sure that you go in if you have equipment or if you have computer systems or camera systems or anything that you have, make sure all that's working. The worst thing would be is that you get ready to reopen and you're ready to go and you realize a system is not working that is critical for your business. So be sure that you have that and you test those systems before you get started. So one big thing that we do want to mention is cybersecurity. We work with CISA, which is Cybersecurity Infrastructure Security Agency, which is part of the Department of Homeland Security. They have definitely seen a growing cybersecurity threats based on COVID-19 related themes. And, it may be emails that are sent. It may be that people know that there is a lot of teleworking going on. So make sure that you take into account and you have a cybersecurity plan that makes sure that you protect your organization. Remind employees do not open any email or attachments that they are not expecting, that they don't know the sender, ask for personal information, look suspicious. We know those things, and I'm sure you as a manager, owner, general operator, those things, know that, but make sure that you remind employees not to be mindful of cybersecurity. I can't stress that enough. We've definitely seen several alerts that have been put out from CISA. So if you do subscribe to any kind of cybersecurity alerts, make sure that you have those and you're monitoring what you are seeing out there as far as cybersecurity goes. Continuity of operations. I want to talk just a little bit about this for a minute. Continuity of operations looks at the business and how can it keep the business keep going. You don't ever want to think about you as an owner or manager, whatever position you hold. You always, I know I do, always want to think about, well, if I'll be always available to make decisions, but unfortunately we know that may not always be the case. So whether it be that you get something happens to you and you're not available to your team, make sure that you have you've predetermined who can make decisions for your business organization if the owner, operator, general manager is not available. Make sure that you have, what we say there is make sure you have a line of succession for your business so going into it what decisions can be made by somebody else if you are not available. Do you have any responsibilities that you have signed to someone else? If you do, make sure those are documented. We want to make sure in that way it helps you. It helps if something happens. It helps make sure you know who is responsible for what. Who may have keys or passwords or those kind of things that are critical to your business should you not be available. Do you have multiple ways to contact employees? Unfortunately, like we said, the virus is still out there. Even though we have across Georgia seen a decrease in the number of cases, a number of new cases across Georgia, we want to make sure that if something were to happen at your facility, make sure you have several ways to get in touch with employees on very short notice. That, it may be the overnight that you say, hey, don't come in tomorrow. Make sure that you are looking at that and make sure you keep your contact information for your employees up to date. And a lot of you have probably been doing this, but once you get going and once you reopen, ensure you can continue to have access to your critical systems remotely. That was not a service or something that just you had temporary. You're going to want to continue to be able to do that for the foreseeable future. So one thing we want to encourage people to remember is mental health. Okay, the last few weeks have been stressful. They've been stressful for everybody. They've been stressful for you as a business owner or manager because a lot of you have been limited on your operations, have not been able to maybe have the full functionality of your business. We know that it's been a financial stress for you, but know that employees have been stressed as well. They have been stressed at home. A lot of your employees are probably, like my family is, having to do schooling at home and balance work, life, school. Kids that are ready are going, getting cabin fever and going stir crazy. So know that employees are likely going to be stressed when they get back. They're going to be stressed just getting started to work again. They're going to be stressed on what is the expectation? Where do you get started again? So do you have a plan on how to reopen and what are the critical tasks when employees come back? How do they give employees a way to prioritize what is the most important for them? But remember that employees are stressed. We know that pandemic can create mental trauma. And to know that people, the last few weeks and some people could have created a trauma for them. So be ready for them. If you offer EAP for employees and it's some kind of an employee assistance program, make sure employees have that information. Remind people that we understand that it's been stressful the last few weeks, and to make sure that they have the resources to be able to reach out. The state has resources out there, mental health resources that are free, and we will be happy to share those with you as well. Have a battle buddy. This is something that a lot of people, I think, try. You get people, I know I'm sometimes guilty of this even as well, but have somebody that you can talk to, that you can vent to, that you can share your stress with. It is extremely important. You, as likely most of you are leaders in your organization, there's probably been a lot of stress on you. So make sure that you have a battle buddy, somebody that you can talk to that understands what you're going through as you reopen your business. The next few weeks, once you reopen, are going to be stressful. We completely understand that. So make sure you have somebody that you can talk to. We talked about this. One thing that will help with employees with their stress and mental health is if you give clear direction and expectations when you begin to open back up. Like I said, so employees know what is the priority to work on. There's a lot that's probably been backlogged. So where to start? That can be very overwhelming for people. It's probably overwhelming for you right now to think about. But make sure that you have sit down and come up with what are those expectations for employees. So we talk about safety. Do you have the proper thermometer to take temperatures? A lot of businesses are going to have to take temperatures for your employees. So do you have the proper thermometer to do that? Those are generally no contact thermometers you put up to the forehead. It takes a couple seconds. You take the temperature, and generally what we're looking for there is anything over a 100.4 degree temperature. Do you have the proper PPE to give to employees? So whether it be masks, gloves, a lot of that has come out and I'm going to show you a resource here in just a second, so that you can know what is expected, what is it that you should have for employees. Do you have that? Do people properly know how to wear PPE? Okay, so this is one of the probably the biggest mistakes I see. So if you require your employees to wear a surgical mask, for instance, you have to know that the surgical mask is meant to keep the virus from spreading. So it's intended to keep my droplets, and it doesn't allow them to spread. So this should properly cover the mouth and the nose. Okay, now a lot of people have made their own masks, but it is important that this properly covers the face, the mouth, and the nose. One thing that will not instill confidence in your customers is if people come in and they see employees not wearing the PPE the proper way. There are resources out there that show you how PPE should be worn properly, and we can share that link with you as well. So, but just know I've seen a lot, even as I've been out and about, people that have it and they wear it under their nose and like this, or they have it on but it's down here. You are requiring people to wear it. Make sure that they wear it properly. And do you need to restrict visitors? You may have a facility where you do not want visitors coming in. You do not want vendors to make deliveries. Those are decisions that you have to make, and as a business, and let them, if for instance you are not going to accept vendors and to make calls on you because they're coming, you want to keep your facility contained with just your employees. Those are just conversations that you will have to have with those vendors, with those providers that may be calling on you. You may want to set up a designated location for deliveries. Deliveries come in one specific door, and they're left in one specific place. Make sure that you have, how that you're going to handle those cases going forward. There will likely be things that you don't think of that come up. We can't think of everything. And so we just want to, but just be thinking about that. Do you want to restrict visitors? There are definitely some cases where I've seen that happen, especially if it's a critical infrastructure type business, where people do not want others from the outside coming in. So just know that as we go forward, be thinking about that you need to restrict visitors. These are not things that we want to think about, but there's a link on the bottom here about, if you have an employee once you return to work that does develop an COVID virus. So what is it? First of all, you're going to want to know, is it confirmed? Have they taken a test? Or are they just symptomatic? And then you're going to want to do, for instance, isolate and quarantine confirmed employees. Work with the employees that were working near an infected coworker. Clean and disinfect the workplace. We talked about suppliers. I would go ahead and know if you had this happen today. If something happened today and you had an employee tested positive, who are you going to call to come in and disinfect your workplace? And then notify all employees. There's a link here that will be in the PowerPoint. It has some really good information from a law firm, and we will just very good, simple information. And so you may want to take a look at that. But think through how you're going to handle a COVID case. I will say the Georgia Department of Public Health is increasing their contact tracing, but there's probably going to be some things that you will have to do. For instance, provide information on that employee and who they were around, the people that were at your facility that day, who was working that day. So it's good if you are going to have a staggered shift, and you are going to allow employees to work from home some days and work from the office some days, that you know who's in your building each and every day, and even make it a routine. So the same employees have the same schedule on, Monday they work from home or work remotely, Tuesday they're in the office, Wednesday they're in the office, Thursday they work remotely, Friday, whatever it is. I would keep it consistent amongst your employees. Try to keep those schedules as consistent as possible, because if something does happen, it does help us with the contact tracing at the end. So some other considerations for you, write down a detailed plan for reopening. Who's going to have those responsibilities that we talked about? How are you going to handle, different things? How are you going to take temperature? Who's going to be responsible for doing that? Make sure those things are written down. It may not be a person, but it may be a position. For instance, we are at the 911 Center, we are requiring people to take temperature. Well, we have a plan on who is authorized to do that. I do not recommend allowing people to take their own temperature. I think it is, you hope you never have to think about this, but we want to make sure people are honest and that they are, we know for sure, and for sure as a business operator, that everybody is safe and healthy to come to work. Looking at phasing, you may want to phase in your reopening plans. I've heard several people talk about, hey, we're going to start bringing some staff in. I think that's a great idea. You're probably not going to want to go all of a sudden and bring everybody in at one time, but you begin to phase in those operations. It's going to be an adjustment. It's an adjustment for your employees. It's going to be an adjustment for you as you to bring people back. If you do face the public and you do have a lot of public, you're going to have probably some questions. And so I would have some common questions either written down on a document or go over with employees on what is the expectation of responses. So know how an employee, tell an employee how to answer certain questions that may come up, and make sure they know who to go to if there are questions that come up that they cannot answer. You want to make sure you have a consistent message across your organization. There's a lot of information out there. This is a great time if you have not built a emergency preparedness plan for your business. This may be a great time to begin to build that. If you go to ready.gov/business, there is a lot of plan templates, training videos. There's a full planning suite for business continuity. We partner with the chamber a couple times a year usually and do an emergency preparedness presentation for businesses. So this is one thing we always encourage people to have. You never know. When December 31st hit, we did not know we would be where we are today. And so you never know when the next something is going to happen, whether it be a pandemic, a tornado, ice and snow. We never know when the next event is going to happen. So we want to make sure we're prepared for that. The last thing I'll say is, throwing a quote here I think is important for business owners and managers to keep in mind, is that things change, and we never know. Things seem to be changing hour to hour, day to day. But we keep our aim on the future. And so this is a quote that I think we all need to come around and look at, that, as we have to be focused today, remember that we are all in this together and that things are going to get better in the future, and we're likely all going to come out stronger for it. So with that, before I take questions, I do want to show a few resources online for you that we can look at here. Bear with me for just 1 second.
Chris, while you find that, I want to encourage everybody, if you have questions, to put them in the chat field. We've got 4 or 5 pre-submitted questions, and then we've had a few come over in different areas over the last 30 minutes. If you have any other questions, put them in the chat, and we'll address those as we can.
Okay. So I do want to bring this up. There's a lot of good information out. The Georgia Department of Economic Development, the Chamber has referenced them quite often. But if you've not visited their site, there is a lot of good information on here for you to go in. There are industry-specific requirements that are available on their website. Okay, so healthcare business guidelines. You can go through here and look at dental practices, optometrists. You can scroll through. Just want to make sure, Jimmy, can you all see my screen? I just want to make sure that y'all can see this.
Yes.
Okay.
Yes, sir.
Restaurant dining services. Restaurants, there are about 30 different requirements for restaurants to reopen. So I know I'm scrolling fast through here, but you will see there are a lot of things here that restaurants have to do to reopen. I'm sorry, there's almost 40, not 30. This is one that will be parents that if you have kids and you want to go to Chick-fil-A or McDonald's or somewhere that has a playground, those will remain closed. So wanted to say that you will not be able to take your kids to the playground at the restaurant. Food establishments, grocery stores, hair designers, massage therapists, body art studios, tanning facilities. Here is what they have. Gyms and fitness centers. So some things about gyms and fitness centers, if anybody is on the call that has that. Obviously, there's a lot of things about sanitizer, taking temperatures. The gyms and fitness centers cannot do group classes. I do want to point that out. Halting the provision of in-facility child care services. So if you go to a gym, also the following facilities within the gym are to remain closed. Pools, basketball courts, other group sport areas, hot tubs, saunas, steam rooms, tanning beds, if they are within a gym or facility. So there is some really good guidance on the Georgia Department of Economic Development's website. We won't go through every single one of them. And also, if it's not included here, there are some others at the bottom of this page. This link is in the chat feature. This one is already there. So, also, this is the state of Georgia. Yesterday, they updated the website, and so you can see on the state of Georgia where we stand. There's some really good information here, but if you go over and hover over this site, you will see, and we hover over Forsyth County, you will see the number of confirmed cases. What's important, I do want to point out here, is the total hospitalizations. This is a number of total people in the county that have been hospitalized that that the state is aware of. This is not the number of people that are currently in the hospital. We want to make that clear. So just as you look at this and guys, this information, just wanted to make sure you are aware of that. We have had some questions about our cases over time. And so this graph looks at our cases over time. As you can see, the last few days, we have definitely seen in the state a drop-off of cases. That doesn't mean that there may not be places around the state let me rephrase how I say that. We will continue to see an increase in cases across the state. That is expected. It's not that we have stopped all cases. It's just looking at the number of cases day over day and the increased number in cases. So you can see here some good information here on our cases day over day. Over time. So this is just information. Some people have had questions about testing. This looks at labs, testing over time, whether it be commercial labs, public health lab, wherever it happens to be. I wanted to show this and point this out here. So this website has a lot of information. Like I said, this just got redesigned and put out yesterday. So this is brand new. So you can definitely see some good information here. The county has a website, if you've not visited it, that has the executive orders, the link to the executive orders, some other links. So this is the Georgia Board of Cosmetology and Barbers issued their guidance. So we link to a lot of information so that you can go on and try to have one central point of information. The executive orders, these are all the executive orders that we talked about. Just yesterday, there was an update for food service establishments about hand sanitizer. You can go on here, download these PDFs, and it will have the information you need. And to prepare your small business, the CDC has put out some information. This is also available in other languages. You can print this page. It has some places, some information in here, and tips, 10 tips on how to keep your business safe. We've talked about a lot of that. But, have hand washing signs up. How do you etiquette for coughing, sneezing? You can click on here and it will, go through how to adequately protect yourself when people cough, sneeze. We don't want people to cough into their hands, sneeze into their hands. That's the big thing. Even though most people have stopped shaking hands now, it's very odd, even, for me. But still, we need to make sure we're practicing good hygiene, whether you're at home, at work, wherever you happen to be. So those are the resources that are out there, and we wanted to make sure you were aware of that. Now, some questions have come up, or as resident, to support your local businesses, obviously do business with them. But when you're out, be mindful of employees working. They want to keep your distance from them. Just as if you're out and you're shopping somewhere, you want to, you're visiting a restaurant, do the things they're doing. I would recommend, we're encouraging everybody to wear masks. I know they tend to be uncomfortable, but we definitely have seen where people are asymptomatic that can pass the virus. So, wear a mask if you're in public. That's something that is encouraged. It's not required, but it is encouraged so that we try to help to stop the spread of that virus. So,
Chris, we have a question that was pre-submitted. What are recommendations for employers when it comes to time clocks, door handles, vending machines, etc.?
So you definitely want to look at how often you should be putting, either going through and sanitizing it. There are some of the industries do have specific guidelines in the executive order on how often they have to sanitize, for instance, door handles and doors. But, maybe it is that you have Clorox wipes or some kind of sanitizer wipes next to those. If you can not practice time clocks, and whether there's a lot of technology out there where people can do it on their phone, clock in on a phone, maybe go that route. But, if you're having people clock in, spread them out. Don't let people, everybody get there at 8 o'clock, for instance, and have a line of people. That is something that we don't want to do. And then we're having people congregate all together. And that's one thing that is talked about in the executive order, where people should not be congregating at work. That includes clocking in, whatever it may be.
So to kind of piggyback off that, when do you foresee the 10-person limit in gatherings being lifted?
That's a really good question. I did see that pre-submitted. We don't know. At a local level, we don't know. That is something that will be determined by the governor and by the Georgia Department of Public Health. As a reminder, just so people know how this works, anytime there's something like a pandemic that happens, the Georgia Department of Public Health is the lead agency across the state. They're the one that has the healthcare professionals. They're the one that has the epidemiologists. So they're looking really at a statewide perspective. As you can see in the last executive order, there's some things that, even though we've opened some businesses, some things are still just not allowed to operate. Things that have large venues, amusement parks, or those things are still not allowed to operate because they draw a lot of people together. So we'll continue to watch that, and we'll work with the chamber to make sure that once those things are lifted, that the chamber is able to share that as quickly as possible.
Got a couple questions on the chat feature. Do you have this one? Let me see here. Will there be lessons learned and best practices that local businesses can share with the community during this phase?
So I think a lot of that is going to depend on your specific industry. We've already seen some of that come out from like the National Retail Association and some of the food service associations. We've already seen some best practices come out. So I would encourage you to, if you have a professional association or an organization that you belong to or can belong to, I would encourage you to look at that because a lot of these organizations are pushing out best practices as they see things from across the country. That's one good thing about having some kind of national organization that you follow is that they tend to be looking at things from across the country, maybe even some of the harder hit areas, things that have worked, things that haven't. We've learned a lot from public safety agencies from across the other areas. So it's definitely something that you want to try to maybe look at.
So one of the questions that we had, one of the first ones that came in was, what can community members do to assist businesses to be safe when patronizing their businesses? And I guess part of that goes to, you mentioned, how do you wear this PPE? Could you also share that link that gives people sort of the guidelines of how to do that?
Yeah, and we can do that. And we'll work on, not already, we actually had this conversation. We're going to be putting that on the county website as well. So if it's not already there, it will be going up here very soon on how to properly wear some of these things. But that's one thing, like I said, I'll encourage is make sure, especially if you're an employer, people know how to wear it. I've seen it several times where people are wearing it wrong. So make sure that, it's not going to instill a whole lot of confidence in your customers if you're not wearing it properly.
So we've done multiple member surveys as an organization, and the one thing that people have asked, there's a question that basically says, what can we do for you? And that is to acquire PPE. If one of the questions was, if you come across somebody who has mask, hand sanitizer, whatever, they have the accessibility to that, where can they donate that? Who can they get that to? Obviously, they can share that with us, but who can they do that directly with, Chris?
If you're wanting to donate it to a public safety organization, the best thing would be is to reach out to emergency management. And because we work across the entire organization with both the county and the city and our public safety partners, healthcare partners, some certain number of healthcare partners. So we're kind of able to see the need. So you can always reach out to us. You can call us. Probably one of the best ways to do that is to email us at EMA, like Emergency Management Agency, but EMA at forsythco.com.
I think we have time for about one or two more questions, Chris. We've got a hard stop here in just a couple of minutes. Has Georgia met the necessary guidelines under Phase 1 of the White House administration's Opening Up America Again plan?
So we do know the phases. We are taking direction from the governor, and so the governor has opened these businesses and has allowed that to happen. So we will continue to follow his guidance. I will say one question that we have had is, are businesses under a timeline to open? The answer is no. You open when you're ready. And so that's a decision for you as the owner to make. And so you make sure that you're ready to open it. Make sure you have the things in place to be able to open when you're ready. There is no timeline. It's not, nowhere does it say certain business have to be open by a certain date. That's a decision you as a business manager, owner, have to make.
Okay, very good. I think we're up on our time, Chris. Before I let you kind of close this out with any last thoughts, if you have any last questions or anything that maybe you think of even after this webinar is over, please send them to us at the Chamber. You can send them to either my email, jlane@focochamber.org, or to Jesse Martin as jmartin@focochamber.org. And we'll gather those up. We'll get those over to Chris and get you the best answers that we can in a soon of a time frame as we can. But Chris, anything that you would like to leave us with as we close out that people should be thinking about, or that's just important for them that we haven't covered that they would need to know?
No, one, I want to say thank you for all the support you've given. A lot of you have given us. Thank you for that. We have a great community, and we want to make sure that you know that. A lot of things, we're very blessed here in Forsyth County. And so I just want to say thank you on behalf of the Emergency Management Agency. Thank you for all you've done to keep our citizens safe, to keep your employees safe, for taking the time today to listen to this. I hope it has helped answer some of your questions, or at least have you think through some things as you begin to reopen. So I hope that helps. If we can ever be of assistance to you, don't ever hesitate to reach out to us, and we'll be happy to. And we look forward to continuing to partner with the Chamber and do more emergency preparedness topics for you going forward in the future.
Thank you, Chris. I know you guys are working long hours and 24/7 right now. And to that point, for those of you who are still on the call, make sure you're looking out for information from us. We will continue our emergency preparedness sort of series this year. It may be just like it is now digitally and not actually at the EOC. But we're going to continue to do that because, just like Chris said, January 1st, we had no idea we would be dealing with something like this. We always need to be prepared. But with that, thank you all for being here today. We appreciate all that you are doing. And everybody stay safe. We've got a number of great webinars and information that we're getting out during the course of this week and future weeks to come. So stay tuned. Look forward to seeing you soon. Have a great day.
Thank you all.